It's 17 minutes after the hour of 6 o'clock. 17 minutes after the hour of 16 minutes after the hour of 7 o'clock. 16 minutes after the hour of 7 o'clock. Welcome back to the No Morning Show here on TTT. I am Natalie Leguan. Joining us this morning for Your Body and You is Dr. Derek Chen, who is an anesthesiologist. And we're just going to find out what really happens when you go under. And no, we're not talking about Australia or under the seas. We're talking about when you go under general or local anesthesia. What happens to the body? Where are you? Do you go to heaven? I know that there are some people who are probably thinking that, but let us not assume, but find out from the expert, Dr. Chen, about what really happens. Good morning to you, Dr. Chen.
Good morning.
And thank you so much for joining us.
Thank you.
Doc, let's just start with the basic, which is anesthesiology. Why can't I say it? What really is the discipline about?
Well, anesthesiology is the study of how do we put patients off to sleep so that they may be under an anesthetic, so they do not know what's happening, that they may not be able to feel pain. And the third thing is they are relaxed under surgery. Now, saying that it is comparable with what we're now doing with a local anesthetic. So we need to know what's a general anesthetic of putting you under, and a local anesthetic, which is a local method. Okay?
Right. So let's start with the general, because I think this is where a lot of people have raised questions, because with the local, we're still awake, we're still alert, and even though we're relaxed and we're able to do what we need to do, is that we don't have that awareness when we are under general anesthetic. So talk to us about that. What really happens when you're under general anesthesia?
Well, once you go under general anesthetic, there are different stages of general anesthesia, of which we put you first off to sleep, the first stage. So you go off to sleep, you lose contact with the environment. Then you go to a second stage where your reflexes are more or less obtended. As you go deeper, you go down to the plane of surgical anesthesia, where they can now proceed with the surgery. So there are various stages. And then if we need to get you deeper than that, we can go to another stage, a fourth stage. So there are various levels of anesthesia that occur during the process of going under a general anesthetic. Okay?
Mm-hmm. Talk to us about them.
As I said, I went through this now, the different stages.
Right. No, sorry. So you talk about, just going to sleep, then going deeper, then, so 4 stages. Are those the only 4 stages, or you can even go beyond that?
Well, if you go beyond that, it's coming on to basically end of life death. If you go really very deep. Okay? And it all depends on the procedure that you're doing, what level of anesthesia you require.
Right. So the procedure determines the level of anesthesia. Could you just give us maybe some examples, like, if it's heart surgery, what level of anesthesia you need as compared to, if it's, let's say, to remove a limb?
Right. Well, all surgeries, you're aiming to get down to the third stage of anesthesia, which we call third stage, plane 2. And that's the stage for surgical stimulation. You don't want the surgical stimulus to cause a response from the patient while they're under. So that's the level at which you want to get everybody basically going under general anesthesia too, so that they do not feel pain in particular, and they're relaxed enough for the surgeon to do what he has to do.
And Doc, everybody has different body types and different mechanisms. How do you determine how much anesthesia is needed for a patient?
That's very true. Each individual is an individual, and we cannot say everybody is the same. So it all depends on what your status is before surgery, what comorbidities you have, what drugs you may be taking, and what experiences you may have had before. So all these factors factor into the level of anesthesia to which you may be able to take a patient down to under general anesthesia.
So let's say somebody has comorbidities. Does that require more or less anesthesia?
It depends on the comorbidity. For example, if you have high blood pressure and you need to keep that pressure under control, obviously it may take more anesthetic to keep you under if you have a weaker plan with your medication. Okay? So you may be anemic, that meaning that you have a low hemoglobin level and you're more sensitive to the anesthetic, and therefore you got to be very careful in giving the patient too much anesthesia.
Right. So it really then is very scientific in terms of what anesthesia, what patient, what comorbidities, how much anesthesia then?
Certainly it is, because since all these factors play a role in administering an anesthetic, one has to be very careful how it is administered. And therefore, monitoring of the patient is so vital. And this is where we look for the various signs that change as you go under and be able to tell at what level you're at. So a good anesthetist or an anesthesiologist will be able to pick up those vital signs and use them to guide the level of anesthesia that is necessary.
Right. All right. So let's talk a little bit about the monitoring. What are some of the things that anesthesiologists monitor on a patient when he or she's under general anesthesia?
Right. So basic monitoring deals with, as you know fully well, that you need to have a blood pressure. So cardiovascular monitoring parameters are what we look at very carefully: blood pressure, pulse rate, okay, and to be able to tell what's happening. So whether it goes up, whether it goes down, whether the pulse rate goes up, whether that goes down too, and so on. And there are other advances in cardiovascular monitoring, which we won't go into now because it's a lot more intricate. And there's other monitoring. The other monitoring is obviously important, is the respiratory monitoring. How you're breathing under anesthesia, or whether we have to paralyze you to go under and to keep you paralyzed for the entire operation. So it depends on the technique and what we're going to do for you.
So, Doc, are you suggesting to me that then probably the next thing we have to look at is side effects? Because if you're going to be paralyzing somebody to go on under anesthesia, isn't this dangerous or precarious?
It may sound dangerous, but because it's part and parcel of type of anesthetic that you administer, not all patients under general anesthesia need to be paralyzed. It all depends on the procedure that they're doing. And therefore, paralysis for muscle relaxation, that's a component that I talked about being relaxed. You need to have the patient relaxed. If that is necessary, and you got to paralyze the patient temporarily, we do that. And therefore, makes it a lot easier, more accessible for the surgeon, and a lot quicker.
But let us talk about what happens to the body then. For the patient who goes under, are there any contraindications, any side effects to going under anesthesia?
Certainly, it has to be ruled out in your preoperative assessment. Should the patient have any side effects or before, if they've had the experience before with anesthesia, what sort of side effects they may have had if they've been told. And therefore, one has to be on guard for any sort of reactions to the anesthetic per se, because it's a drug, it's a chemical, and therefore patients, like anybody else who's taking a chemical substance, will have effects. And those effects that we look for or try to elucidate from the patient is what we try to get before surgery, if they have any allergies, whether they've had bad effects on drugs that have been taken, and therefore it gives us an indication as to what we should use and what we shouldn't use. And therefore, again, that's a factor that we take into consideration in determining the type of anesthetic.
Do you ever have, not you as a doctor, doctors ever have circumstances where somebody goes under anesthesia and doesn't wake up?
Well, this is something that we guard against and something which we would not like to see happen. And it can happen on occasion, but it's very rare today. And that is because of the changes that have occurred over the years. And because we have much better monitoring apparatus, these things tell us early warning signs. And therefore, it's up to the anesthetist or anesthesiologist to be able to recognize the warning signs and do something about it before it happens. And therefore, not waking up, whether it depends on the type of anesthetic that you're given, or whether it's the patient condition that has deteriorated under the operation, or whether it's surgical causes. And therefore, those factors have to be weighed against each other if your patient did not or could not wake up at the end.
Yeah. And we spoke about comorbidities, but outside of people with comorbidities, let's say those who are healthy, is the amount of anesthesia we're given, is it dependent on our BMI? Is it dependent on, our weight, or what is it dependent on?
As I said, again, it's a lot, you're bringing in a patient factor here of weight or size. And certainly that is important as regards to the amount of anesthesia that you may require. And therefore, not because you're big, you need a whopping dose of anesthetic. You just have to make sure that what other factors you have involved with your condition, that we weigh the amount of anesthesia that we administer. And therefore, yes, I would say BMI is an important thing because overweight today is a major problem. And therefore, the implications of that and the impact of that on anesthesia is causing very grave concern.
And we talk, what are the different kind of anesthesias? I wouldn't know classification.
Well, I like to keep it simple. You either have a general anesthetic or a local anesthetic. And today, a lot of them are combined. So you get a general plus a local. Or you may have a local and then have to have a general administered at the end. It all depends on how long it's taken and what type of surgery you're having. Now, the local anesthetic types could vary. It could be from a topical anesthetic, a local infiltration anesthetic. Say you have a small lesion on your skin or so on, and you just need a little bit of local anesthetic to numb the spot. Or it could be a little wider, and therefore you could go into a regional block, like a plexus block. That is like the upper arm. If you're having a surgery on the upper arm, you can have an upper arm block. And there are different approaches for that. Similarly, you can have a regional block that we call neuroaxial block. And that's going into the spine now, where you're looking at epidurals, spinals, and these type of blocks that they are being administered more frequently today and doing very well with outcomes.
But when I hear you talk about these blocks that people may take for the localized areas, I'm starting to think, but do we have situations where there are long-term effects of having those kind of anesthesia?
Not really. Well, when you talk in terms of long-term effects, you're talking about whether the patients have had any sort of side effects or complications following the block.
Yeah.
In which case, yes, you could have long-term effects. However, anesthesia is supposed to be reversible, whether it's general or local. And therefore, with time, it should wear off. But unfortunately, sometimes, depending on the patient's status and what procedure they've had, you may not have 100% recovery.
And are there any classification of patients that doctors would say you cannot put under anesthesia?
Well, there are some situations where patients may have had bad effects from previous anesthesia, and therefore you will not want to use the same type of anesthetic for that patient. However, if the procedure do require an anesthetic, I'd say to put you under, because general anesthesia could just be conscious sedation that we're talking about, or mild sedation techniques to a full general anesthetic. And therefore, it varies depending on what type of surgery you're having, and to the patient's consent for the type of anesthesia. So it's very important that the patient communicate with the anesthetist or an anesthesiologist and understand what is going to be done. Quite often, the anesthesiologist may not be seen until the time of surgery. And this is a very grave concern because establishing rapport with your patient is so important. It's so important that the patient understand what is going to happen and and they can ask you questions.
You know, I went under general anesthesia twice in the last 3 months, and well, 3 times in the last 5 months, realistically. And twice when I was coming out of anesthesia, the nurses told me I was fighting. Is that a reaction to the anesthesia? What do you think happened there? Because I don't understand it, because I'm telling them I don't have any control over my reaction waking up from the anesthesia.
Right. And this is common to see patients waking up sometimes not smoothly. And then I always think back as to what type of anesthetic was administered, how much was given, and whether it is a side effect of the anesthetic given at the time. One has to go back and more or less walk through the process and see what was actually done, what type of patient you are, first of all, and whether it's a reaction to the type of anesthetic that was used. And therefore, seeing that happening on a second occasion, it comes to my mind that I would question, why really is this happening? Because should you have to go back for another one, I wouldn't like to see that happen. And if I could avoid it, I would need to go through your entire process.
Right. And is there anything such as having too much anesthesia throughout your life or in a particular time frame? Are there limitations to the amount of anesthesia that we're supposed to be exposed to?
Well, the types of anesthesia that we're using and types of agents that we're using have changed over the years. And when they used to say that you should not have an anesthetic within a week or 3 weeks before another one, today, because it's so worn off or it's excreted so rapidly, right? Very little is absorbed and stays in the body for very long. So hopefully you can have multiple anesthetics carefully given and within short space of time. The longer you can wait, the better. But sometimes it cannot. And therefore you come back to surgery within the week. And therefore we just have to give it to you and make sure that everything runs smoothly.
Right. And I know that you're saying that there are different levels of anesthesia that people have to go under. And does all of them include, having that breathing machine put into the throat, that breathing tube down the throat?
No, not all patients. If you have to go under a general anesthetic, you can either be what we call intubated. That's the tube that goes down your esophagus, down your trachea, right, that we put in to breathe for you. Or you can have an anesthetic without, right? In which case you stay spontaneously breathing under face mask. Or what we have now these days is called a laryngeal mask that is inserted. And therefore, not every patient has to be paralyzed and put a tube in. It all again depends on the procedure and whether you can be kept under just a face mask or some form of mask.
Doc, we have just about a minute and a half left. What did I miss? What is it that I missed that you think I should know?
Well, I'm just wondering what else you need to know, because I think you're relating to your experiences, and that is good, because quite often patients do not search for answers for all what they have undergone. And as I say, once a patient is well educated as regards their circumstances, they'll know what to tell the next anesthetist or anesthesiologist. And therefore, precautions can be taken, because today, patient safety is uppermost. And therefore, not only that we take care of you while you're under, because the anesthesiologist quite often not looked upon as the big guy at the table, but your life is in our hands. And we therefore have to make sure that how you went under, you come back out same or even better. So it's a road that we have to walk with each patient individually. And therefore, your communication with us and we with you is so vital for going under an anesthetic, that you understand.
Dr. Chen, I want to thank you so much for sharing your wealth of knowledge with us. I'm sure that people have a better idea now. I didn't even know that there were different levels of general anesthesia. And it never ever crossed my mind that, based on different people. We're going to have to treat with them differently. So I think we learned quite a bit today. So I want to thank you so much for joining us.
You're welcome.
You're most welcome. Dr. Derek Chen, their anesthesiologist, speaking to us about what happens when you go under. So don't worry. Just speak to your doctor. As you said, you need to have that one-on-one time with the patient so that the patient can understand what is about to happen and so that they can feel safe and that they can go in safe and come out safely. We take a break and we'll be back with you.